Myeloma is the most frequent cancer to involve bone, with 70% of patients presenting with bone involvement and 20% having a pathologic fracture at diagnosis. It's responsible for both severe pain, decreased quality of life, and also affects mortality. The major problem with myeloma bone disease is it doesn't go away. That is, the lesions that develop never heal, and patients continue to suffer from their bone disease even when their myeloma is under control. Over the course of the disease, 85% of patients will have bone involvement with myeloma. Currently, we have no drugs that will build bone in myeloma that have been shown to be safe, so that it's a major challenge. Other challenges that are involved with myeloma bone disease is that duration of therapy, frequency of therapy are all still open to question and being investigated, and there's no good biomarkers that can be used routinely to monitor bone disease and its treatment. First of all, they should realize that just doing skeletal x-rays underestimates the amount of bone disease a patient may have, because you have to lose 30 to 50% of bone at any particular site to show up on an x-ray. Whole body CT scans are much more sensitive and can be done now, and really are probably the imaging modality of choice for the patients. Further, I think people have to be very aware that pain and bone pain in myeloma patients is undertreated, and it's really very, very important to try to get this under control. Also, monitoring vitamin D levels and calcium levels in patients are critical, because all the drugs currently used to treat myeloma bone disease just block bone resorption so that patients can become hypocalcemic. And the fact that more than 70% of patients with myeloma present with vitamin D insufficiency or deficiency make that a major problem.